is the best time to take the pregnancy test? When should you take the pregnancy test? Would you like to know if you are pregnant? When should you take the pregnancy test? In this video today, we are going to discuss the best time to take the pregnancy test. If you would like to confirm when you are pregnant, then this video is for you. Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel, and on this channel, we do create awareness about fertility and reproductive health. Subscribe so that you do not miss new videos we release every day. When is the best time to take the pregnancy test? Without further ado, we shall first of all understand that there are two types of pregnancy tests. The first test is where we use a sample of your urine, also known as the urine HCG test. And then the next type of pregnancy test is what we call the serological pregnancy test. The serological pregnancy test. Here we mean a sample of your blood will be taken and then it will be tested in the lab. What we normally look for is a hormone known as the HCG hormone, or the human chorionic gonadotropin hormone. So when this hormone has been released into your blood, or when it is being released into your urine, then there are high chances that you could be pregnant. But remember, you could be having issues with the urine HCG, or you could be releasing the HCG hormone and then yet you are not pregnant. So always when you are doing these tests, the pregnancy tests, and the results are not conclusive, you are thinking that you are experiencing some issues with the results, then please remember to consult your doctor urgently, whereby further testing will be done. The further testing we are talking about, your doctor might also request for an obstetric ultrasound scan to really confirm how your womb is, whether implantation or implantation signs are showing on the ultrasound scan. We are talking about the best time to take the pregnancy test. When is the best time to take the pregnancy test? So, having had a brief introduction about the pregnancy tests, and we know right now that there are two types of pregnancy test: the urine pregnancy test and the serological pregnancy test. So we are going to look at when is the best time to take the pregnancy test. If you would like to know when is the best time to take the pregnancy test, for the urine HCG pregnancy test, specifically, this should be done at least 1 to 2 weeks. To be much more to be much more sure, you actually have to wait for 2 weeks and then do the pregnancy test. For the blood HCG or the serological HCG test, the HCG hormone begins showing in your urine at least immediately after 3 days. So if fertilization has taken place, within 3 to 4 days, the blood HCG levels will be detected, beginning from 5 IU per eye, 5 international units per eye. So if at all your HCG levels begin from 5 IU/I, then it means you could actually be having an early pregnancy happening. So the most important thing we need to take here, or the most important point we need to take from this video, is that when is the best time to do the pregnancy test? For the urine HCG test, at least wait for 2 weeks. Even though there are some pregnancy tests on the market which are very, very sensitive, they could even detect this within at least 5 days or even 7 days. But if you actually do the pregnancy test immediately within 5 days or within 7 days, and probably you've used cheaper types of pregnancy HCG testing strips, then you may actually need to sit down, calm down, and then repeat the pregnancy test at least after 14 days. There, if you do the pregnancy test after 14 days, then there are high chances that you will be able to get accurate results. And if you do the pregnancy test and the results are not really giving you what you really expected, then it is high time to consult your doctor, who will go ahead and do other tests. So what are the common tests for pregnancy? What are the common tests for pregnancy? What tests can be requested by your doctor if you'd like to know whether you're pregnant? The first test is what we call the urine HCG pregnancy test, and we have said that it has several types on the market. There are several types on the market. And then there's what we call the blood HCG, which looks for the HCG hormone in your blood. And then the next pregnancy test is what we call the pelvic ultrasound scan. The pelvic ultrasound scan, specifically, it looks at your ovaries. This is when pictures are taken of your reproductive system. Pictures or images are taken of your womb, whereby your ovaries will be visualized. Your ovaries will be analyzed to see whether you have actually sufficient follicles. The follicles are those storage for the eggs. So if at all you do not have any follicles, then it could be that the pelvic ultrasound scan was done at a time probably when you did not have actually those sufficient follicles. Maybe you did the pregnancy test very early when you were still in the follicular phase. So the ultrasound scan can also show how your womb is. Your womb is basically where the baby is going to grow from. So it will show the thickness of your endometrium or the endometrial stripe. If you are having very early pregnancy, then there are high chances that the inside of your endometrium is going to be thickened, or it's going to be very thick, due to the hormones which will be increasing. That is due to the high levels of progesterone and estrogen. Welcome to our channel, and on this channel we do talk about pregnancy. We do create awareness about fertility and reproductive health. We are proceeding with our lesson, and remember to ask me all your questions down below in the comments, and I will answer all your questions. Gerard Master, the health educator, is the name of the channel.
The signs of ovulation. In this video today we are going to talk about the key signs of ovulation. Signs of ovulation to tell that you are ovulating. So in this video we are going to talk about the signs of ovulation. Gerard Massa, the health educator, is the name of the channel, where we shall begin by defining the signs of ovulation. We shall begin by defining ovulation. Ovulation is the release of a mature egg on the 14th day of your cycle. If you are a woman and you go into your periods for at least a length of 28 days, there are high chances that you will be ovulating on the 14th day. The main reason is that the menstrual cycle has two phases. It has the follicular phase and it also has the luteal phase. Now, in between the follicular and the luteal phase, there is the ovulation phase or the ovulation period. That is basically on the 14th day. We are answering the question, what are the common signs of ovulation? Having understood that the menstrual cycle is made up of two phases, the follicular and then the luteal phase, then we shall go to defining the signs of ovulation. The first sign is that you are going to have what we call mitoschemase pain or mitoschemase pain. This is basically a German word meaning ovulation pain, or the pain you get when you are ovulating. So this pain is normally pinpointing, it is normally one-sided. What happens is that when the egg is released, this pain increases and then actually it tends to subside with time. The next sign of ovulation is that there's going to be a discharge, which is going to be kind of like raw eggs, but this discharge increases. This is due to the key hormones, that is progesterone and estrogen, bringing about this discharge. The next sign of ovulation, the next sign to confirm that you have ovulated, is that there's going to be a rise in your basal body temperature, and normally this is a sign that now you have ovulated. So if you are looking at getting pregnant faster, then the best advice is that you should be with your partner at least 2 to 3 days before the ovulation date. The main reason is that the hormones, luteinizing hormone and estrogen, are highest at this point, and your chances of getting pregnant are increased. Remember, this is Gerard Massa, the health educator, and this is the channel you are on, I welcome you, my friend. If you are new here, if it's your first time here, remember to hit the subscribe button so that you get to watch new videos I release every day at exactly 17 hours in the evening. We are talking about the signs of ovulation, and we have said that the first sign is there's a rise of basal body temperature. It actually rises by at least 1 degree. The next is that there's what we call mitochondrial pain. The next is ovulation. There's going to be a discharge which will be released. The next is there's going to be increase in your cervical length. The cervix will move upwards and then it will actually open. The main reason is that it opens so that it allows sperms to pass through when you are with your partner. So if you are a woman out there and you have tried to conceive but you are having issues, you can ask me all your questions down below this video in the comments. Ask me all your questions here on YouTube. You can also ask me on WhatsApp, but you can ask me on YouTube. I will answer all your questions, and yes, I will be able to answer all your questions. Gerard Massa, the Health Educator, is the name of the channel. Welcome and have yourself a fantastic and healthy day. May God bless us all. Bye bye.
Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions,
how to get pregnant faster with one fallopian tube, how you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerard Massa, the Health Educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a very simple recipe. It has worked, it is working for many couples. It will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side, and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes, it is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular client, as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that we about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality, and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost your ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well, and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also remember, what What is a Bartholin's cyst? In this video today, we are going to talk about the Bartholin's cyst. Hello my friend, I welcome you to our channel, Gerard Massa, the Health Educator. On this channel, we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. By the end of this video, you are going to know what a Bartholin's cyst is and what is a Bartholin's cyst and how best it can be treated. So without further ado, we shall define a Bartholin's cyst, and we shall say that a Bartholin's cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a Bartholin's cyst. So we are going to look at the symptoms of a Bartholin's cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk, and then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina known as the labia majora, and specifically one side may be very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cyst?
What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cow peas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bartholin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bartholin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bartholin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bartholin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bartholin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bartholin's glands, and the Bartholin's glands are around the size of pea, that is PEA, cow peas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bartholin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bartholin's cysts. So it is very, very important that when you have a Bartholin's cyst, you should be able to get treatment, and the best way of preventing Bartholin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerard Massa, the health educator, is the name of the channel, and in this video today we have talked about the Bartholin's cysts, and we have said that these are swellings which become of the Bartholin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.
The ovulation calendar, calculating ovulation, get pregnant faster. The ovulation calendar, calculating ovulation, get pregnant faster. Welcome, my friend, to today's lesson. Gerard Massa, the health educator, is the name of the channel, and in this video we are going to talk about the ovulation calendar, calculating ovulation, get pregnant faster. By the end of this video, you will be able to know all the different topics regarding ovulation calendar, the commonest questions I normally get on this channel regarding the ovulation calendar. We are going to answer them today. After this short break, we are going to answer the ovulation calendar. We are going to discuss various aspects. So thanks a lot, my friend, for watching today's lesson. Gerard Massa, the health educator, is the name of the channel. And before we proceed, we need to first of all define what we mean by ovulation. Ovulation is basically the release of an egg on the 14th day when you have a 28-day menstrual cycle. So if you have a 28-day menstrual cycle, then on your ovulation date, specifically, we realize that it is going to be on the 14th day. But also, we need to first of all understand the safe days and then the danger days. The safe days are those days which begin from the day you saw your periods. So if you started seeing your periods, let's give an example of this calendar. If you started seeing your periods on day 1, this is when your periods have started. Those actually 6 to 7 days when you started seeing your periods throughout the whole week, those are regarded to be your safe days. The chances of getting pregnant in the first week when you have just seen your periods is very, very low. And so there are some women who are very fertile and who have lots of follicles on their ovaries. They can actually go ahead and even get pregnant even though they've just finished their periods. And even women who are taking ovulation medications, for example, if you are a woman and you are taking Clomid, you are taking Letrozole, there are high chances that you can get pregnant in the first week. But immediately after the first week, you realize that the following 2 weeks, basically that is from 8th, 9th, 10th, 11th, 12th, 13th, up to the 14th day, that is basically what we call the danger days or the unsafe days. You are most likely to get pregnant when you have just finished your safe days. So we always encourage couples that if you are looking at getting pregnant, then the 7 days after the following 2 weeks, that is basically the days, or that is basically the period when you are most likely to get pregnant faster. Next, when you want to know the safe days after your ovulation or after your danger days, then the following next 2 weeks, we call that the luteal phase. Basically, your chances of getting pregnant are very low. Now, when you want to calculate the ovulation days, normally you will end up, you will actually use what we call the ovulation predictor kits, abbreviated as the OPK kits. Basically, these ovulation predictor kits, they look like the urine HCG testing kits. What you need to do is you have to look at your cycle, and if your cycle is basically for 21 days, then you start testing on day 5. If your cycle is for 25 days, you start testing on day 8. And then if your cycle is for 28 days, you start testing on day 11. And then also, if your cycle goes for 35 days, then you should test on day 18. The testing is basically done whereby you will be looking for the hormone known as the luteinizing hormone. So we shall also look at the cycle length and then the ovulation period. If your cycle is for 22 days, then you are most likely to be ovulating on day 6 up to day 10. From the 6th day up to the 10th day, that's when you are most likely to be ovulating. And if you have a 24-day cycle, then your ovulation period is between 8th up to 12th. And then if you have a 28-day cycle, then it is from 12th up to 16th. So basically here we are looking at the cycle length and then the expected date of ovulation. So before we conclude today's lesson, we have been talking about the ovulation calendar, and then we are specifically covering some brief tips about the cycle length and then how you can do the testing using the ovulation predictor kits. When you look at the reproductive system of a woman, basically this is how it appears, and you realize that when you look at the reproductive system of a woman, it basically has an ovary which is lined with follicles or egg cells which grow from day 0 and then until they reach the 14th day when they get to be released. Basically, this is ovulation happening. What remains is what we call the corpus luteum. So thanks a lot, my friend, for staying around, and I hope you have understood how to calculate your safe days and how to calculate your danger days and how to use the ovulation predictor kits. So I'm really so happy that you have watched today's lesson, and let me know if you have any questions. You can schedule your consultation. The details are in the description. If you want to talk to me, you can go through the description. The details are there. You'll connect with me. You can book your consultation and I'll give you all the time and I'll answer all your questions. Gerard Massa, the Health Educator, is the name of the channel, and have yourself a fantastic and healthy day. Bye bye. And remember to subscribe for new videos we release every day. When you subscribe, you'll be able to watch our videos every day when we release them. We release new videos at exactly 17 hours every day. Have yourself a fantastic day, and bye-bye.
Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.
My cycle is 21 days. How do I calculate when I'm ovulating? My cycle is 21 days. How do I calculate when I'm ovulating? Gerard Mansa, the health educator, is the name of the channel, and today we are going to answer the question: if your cycle is 21 days, how do you calculate when you are ovulating? Without further ado, we are going to answer our question for today. And please, if you are a woman looking at getting pregnant, if you have tried to calculate your ovulation day and your cycle is 21 days and you would like to know how you should or how you will calculate your ovulation day, how to get your ovulation day when your cycle is 21 days, then this video is for you. So without further ado, we shall understand that the menstrual cycle has two phases. It has the first phase known as the follicular phase. Follicular comes from the word follicles. Follicles are those small swellings on your ovaries which actually store the eggs, which grow and then they mature into mature eggs, which actually become fertilized to form an embryo. So the luteal phase is that phase just immediately after you've ovulated. So we've talked about the two phases of the menstrual cycle, and we have said there's the follicular phase and then the luteal phase, and then also on the 14th day. So there are two phases, as we've said. There's the luteal phase, then there's the follicular phase. So what happens is that during the two phases, a woman will go into her menses, and these are very, very significant. So we have said that when you see your periods on day 1, you see your periods on day 2, and then you see your periods on day 3, and then you go on and finish your periods on the 4th day. Normally, these first 4 days when you are in your menses, assuming that your periods last for only 4 days, these 4 days are those days of your period. So if you would like to know your ovulation day, if your cycle is basically a 21-day cycle, meaning that when you see your periods on day 1, you are going to see your periods again on day 21. So if you would like to know the day you are ovulating, simply you begin counting from the first day you saw your periods, and then you are going to count 14 days from the first day you saw your periods, and we shall count and say this is day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, day 9, 10, 11, 12, 13, and 14. So your ovulation day when your cycle is a 21-day cycle is on this particular date, is on the 14th day. If you would like to know when you are most likely to be ovulating, if your cycle is a 21-day cycle, then it means that you are going to be ovulating on the 14th day. And we have said that you begin counting from the first day, the second day, the third day, and then the 4th day when you finish your periods, and then from there you go on and count until you reach your 14th day. That is basically when you are going to be ovulating. But still, we shall take a word of advice that this does not specifically mean that you are supposed to see your periods on day 1. You could actually begin your periods on day 8. Maybe you could begin on this particular date, the 8th day, and then of the calendar. So you specifically have to begin counting from the first day you see your periods. If you first saw your periods around here, and then you begin counting and you say day 1, day 2, day 3, day 4, day 5, day 6, 7, 8, 9, 10, 11, 12, 13, and 14. So if you were to have your periods on this particular date, then it means your 14th day is going to be around here, and then that is when you are most likely to get pregnant. When do you see, or if you are told your cycle is a 21-day cycle and you would like to calculate the day you are going to be ovulating, you simply begin counting from the first day you saw your periods. Count the 4 days or the 3 days or the 2 days you see your periods, and then beginning from the first day you saw your periods, count the 14th day. That is when you are actually going to be ovulating, and that is when you are most fertile. Remember, the days which are in your periods, if you are in your periods starting from day 1 up to maybe day 4, or even going on up to day 7. If you are a woman out there and you spend a whole week in your periods, then just know that the first 6 to 7 days, those days you are actually infertile. The chances of getting pregnant are very, very low. And then the next days after you have seen your periods, that is beginning from day 8 onwards up to the 19th day, that is up to actually the 11th day, sorry, that is when you are semi-fertile. The chances of getting pregnant are 40 to 60%, and then you are at 90 to 99% on the following days or in the next days leading to ovulation. Remember, the whole process of ovulation is controlled by hormones, and though there could be other factors, but the 99% of the women who have hormones which are balancing very well. The hormones we are talking about are two. We have the follicle stimulating hormone, the hormone which stimulates the follicles. Remember, at the beginning of this lesson, we talked about the follicular phase and then the luteal phase. So follicular comes from the follicles. The hormone which is responsible for stimulating your follicles or your eggs so that they grow very well, and then they end up producing estrogen, which is important in preparing your uterine lining or your womb so that it can receive the fertilized egg, and then implantation takes place. Those two hormones, specifically the follicle stimulating hormone and the luteinizing hormone, are released by the anterior pituitary gland in the brain. And when these hormones are released, what they do specifically, they travel to the ovaries and then they stimulate the whole process of ovulation. And that's why if you are a woman and you would like to know when you are ovulating, and basically when you would like to know the time of ovulation so that you can have what we call timed sex, normally you can go on and then purchase the ovulation predictor kits. These are readily available. You can purchase them online. You can purchase them at your nearby pharmacy. These ovulation predictor kits, specifically, they look for the hormone, luteinizing hormone. They look for the luteinizing hormone, although there are some other types on the market which actually look for estrogen too. So what will happen is that you just have to get that predictor kit, and then it looks like the HCG, it looks like the urine pregnancy test strip. You just get it, open it, make sure that you read the manufacturer's guidelines, and then open it. You dip it in the morning urine. Please, you should use the morning urine because the levels of the luteinizing hormone, according to research, according to studies, the levels of LH and estrogen, they are normally high in the morning, beginning from 3 up to around 7 a.m. in the morning. So you get that morning urine and then you dip in that ovulation predictor kit. If I told you were to get the ovulation predictor kits and you used them during these first days, that is from day 1 up to day 7, when you're in your periods, and then even immediately after finishing your periods, these light days, you are going to get actually a negative test using the ovulation predictor kits. The main reason is that there is no luteinizing hormone around here. The luteinizing hormone is going to begin getting high around the time of ovulation, and specifically it is the hormone which is known to actually stimulate the whole process of ovulation. When luteinizing hormone rises around these days here, around your ovulation days, then the luteinizing hormone is going to lead to your egg bursting, and then when it bursts, it releases the mature egg, which goes up to the fallopian tubes at specifically the part which is known as the ampulla, and then fertilization takes place. Remember to ask me all your questions regarding ovulation, ovulation calendar, the ovulation calculator, and then also pregnancy tips. Any questions you could be having, please, my friend, connect with me in my comments. I will answer all your questions. You could also schedule a consultation. You could consult me on my WhatsApp number. You can schedule and then you consult me. I can give you all the time. When you schedule and then you do the booking, I can give you all the time and then we can talk more. If you have any questions and you'd like to talk to me in private, my WhatsApp numbers are on this video. Please, there are two. The first one is +256 701 797876, and the next one is +256 787 668 962. You can book so that you when you do the booking, I can actually analyze and then give you more time, because there are many clients I'm working on. Remember, my consultation is only for $10 US, so you can schedule and then I can answer all your questions in regards to the ovulation calendar, the ovulation calculator, and anything related to women health. Gerard Massa are my names, and we have been talking about, if your cycle is for 21 days, how do you calculate the time of ovulation? If your cycle is 21 days, how do you calculate when you are most likely to be ovulating? And we have said in summary that when you see your periods from day 1 up to day 7, or if at all you stop around day 4, then it means count from the first day, and then on the 14th day, that is when you are going to be ovulating. And then remember, you do not need to mind about the next days, because ovulation happens for only 12 to 24 hours. Gerard Massa are my names, and remember to come back tomorrow for the next video, and have yourself a fantastic and healthy day. May God bless, and please keep watching. I have some important message for you. Thank you.
Hello, welcome to our channel. I'm Gerard Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.
How to calculate ovulation for a Saturday cycle. In this video today, you are going to learn how to calculate your ovulation if your cycle runs for Saturdays. Gerard Massa, the health educator, is the name of the channel. Remember to subscribe for new videos we put out every day. Without further ado, the ovulation cycle for a Saturday calculation specifically begins with us having this example. We are taking an example of the month of August, and assuming you started your periods on 3rd, and then you saw your periods on 4th, and then you saw your periods on 5th. Let's say assume 3 days in your periods. If we want to calculate your ovulation date, or the date when you are most likely to get pregnant, the day when you are releasing a mature egg, also known as a Graafian follicle, let's say we have to begin counting from the first day you saw your periods. If you saw your periods on 3rd, you saw your periods Sorry about that. If you saw your periods on 3rd and then 4th and 5th, we're just taking this as an example. It could be any other day. It could actually even be 2nd. So, assuming you see your periods on 3rd, 4th, and 5th, and you want to calculate your ovulation date, you simply get the first day you saw your periods, which is on 3rd, and then you count the 3 days you are going to be into your periods. But the counting has to begin from the first day when you saw your periods, and then you specifically count 14 days from the first day you saw your period. Remember, once again, we've said that you saw your periods on 3rd, you saw it on 4th, and then you saw it on 5th. So count 14 days beginning with the first day you saw your periods. So we shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So the 14th day, which is actually, it's going to be a Sunday on 6th, on 16th, the 14th day is your date of ovulation. Specifically, this is the day when your hormones, that is luteinizing hormone and estrogen, are at their maximum. When we look at the ovulation calendar, you'll notice that during the 16th day, your hormone, that is the luteinizing hormone and the estrogen hormone, are at their peak. This is the date you are ovulating, and this is the date you are most likely to get pregnant, assuming when you have a 30-day cycle, assuming you spent 3 days. But if you spent 4 months, if you spent 4 days, let's say you started your periods on 2nd, still the same method applies. You have to begin counting from the first day you saw your periods, and that is, let's take an example of 2nd. You still say 1, 2, 3 those are the days you've spent in your periods. So to get your ovulation date, simply count 14 days, but strictly you have to begin from the first day you saw your periods. So we shall count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So your ovulation date, or your date of ovulation, is going to be 15th. The formula is that you have to begin counting from the first day when you've seen your periods, then count 14 days. It doesn't matter where the date is going to fall, but you just have to count 14 days. If you saw your periods on 9th, still you just have to count 14 days, and we shall say 1, 2, 3, and then of course those are the days you are in your menses. We go back to the first day you saw your periods, and we shall count and say 1.
You have been told that you are not getting pregnant. Have you ever asked yourself why you are not getting pregnant? You have taken all the drugs, you have followed all the diet plans, but still you are not getting pregnant. This is Gerard Massa from gerardmassa.thehealtheducator.com, and on this channel we do create awareness about fertility and reproductive health. We are going to answer a question that has been asked by one of our viewers, and this question is this: I had a miscarriage, will I get pregnant again? One of our viewers had a miscarriage and she's asking, will she be able to get pregnant again? Watch this video up to the end and we are going to answer this question together. This is Gerard Massa, the Health Educator, and I welcome you on our channel. Remember to subscribe for new videos about fertility, about reproductive health. We release every day at 17 hours. So, she's saying that she had a miscarriage. Will she be able to get pregnant again? One thing we should take from this question is that there's this word called a miscarriage. A miscarriage is early pregnancy loss. When a woman is pregnant and before the pregnancy makes 20 weeks, the pregnancy comes out, we call that a miscarriage. There are many types of miscarriages or abortions, and specifically we shall not go into all the details, but in brief we have one which is inevitable. An inevitable miscarriage happens whether you've done anything, whether you've taken any drugs or you've not taken any drugs, or it just happens. And then there's that whereby it is incomplete, and then there's another type which is actually complete, and then of course there are other types which are actually known as molar miscarriages. So we are talking about a miscarriage. We are answering this question by one of our subscribers who said that she had a miscarriage and she would like to know, will she be able to get pregnant again? When you look at this question, you realize that at first she was pregnant and then she had a miscarriage. Just by the mere fact that she got pregnant, this means that she can still get pregnant again. The most important thing we need to do here is that she needs to do what we call a pelvic ultrasound scan. She needs to do some tests and then identify what caused the miscarriage. And then after identifying what could have caused the miscarriage, she can still go ahead and get pregnant again. So we are answering a question by one of our subscribers, and she said she had a miscarriage. The question is, will she be able to get pregnant again? The answer is address or handle what caused the miscarriage, and then you will be able to get pregnant again. There are many causes of miscarriages. The commonest causes are infections, for example, a PID, when a woman gets an infection and then she does not treat it very well, specifically a urine tract infection, and then she treats it poorly or she does not get treatment. There are high chances that this infection can ascend upwards up to your cervix, and then it may cause what we call cervical incompetence, or your cervix may actually open up and you can end up into a pregnancy loss. So to answer a question asked by one of our subscribers, it is very, very possible that you can get pregnant again, but use that time after they've done the cleaning of your womb. Use that time to find out more about what could have caused the miscarriage. So we are proceeding with our answer for this question, and we have said that the commonest causes of miscarriages include infections. They do also include stress, and then of course also overactivity. If you are pregnant and you are working a lot, you are sitting for, actually you are doing lots of activities, you are carrying heavy things, you are moving from place to place, and you are pregnant, you are still actually in the early stages of pregnancy, you are in the first trimester, but you are moving a lot. Overactivity can bring about pregnancy loss. So if you are pregnant and you are in your first months, it is very advisable that you do the routine checkups so that actually if at all an infection is identified in your urine, it will be treated by your doctor. And then also if you are undergoing lots of stress, it is very important to deal with the stress, because one thing that is true is that you cannot run away from your stressors, but you can look for ways of either avoiding the stressor, adjusting to the stressor, or even altering the stressor. Because when you are pregnant and you are exposed to constant stress, there's a hormone known as cortisol, which will...
How to calculate your ovulation cycle, how to calculate your ovulation calendar, how to calculate your ovulation calendar, how to track your safe days and your danger days using the calendar method. Assuming you are seeing your periods on the first day, which is around this period on Monday, assuming your menstrual, your first day of your period is on first, which is Monday, and then you see your periods again on second, you see your periods again on third, that is Wednesday, and then also you see your periods on fourth. We want to use this method to identify the days you are going to ovulate. Remember, we've said that when you see your periods on day 1, that is on Monday, day 2, that is Tuesday, day 3, that is Wednesday, and day 4, that is Thursday. Just, we are using this as an example, but it could be actually any other day of the week, but we are using this as an example. So in this particular case, you see your periods for 4 days, that is 1, 2, 3, 4. You started on first, which was Monday, and then you finished on Thursday, which is actually the 4th of Thursday. You want to know your ovulation days, the days you are most likely to get pregnant. We are supposed to do the counting. First of all, we shall understand what an ovulation cycle is. An ovulation cycle, or the ovulation day, the days of ovulation, are those days when a mature Graafian follicle or a mature egg is released, and the chances of getting pregnant are very, very high. So you saw your periods from 1st, 2nd, 3rd, and 4th. what we are supposed to do is to count the days from the first day of seeing the periods to the first day of the next period, assuming your next period is going to be around maybe 26th, 27th, 28th, okay, and maybe 24th when you are getting off your periods. Assuming your next period is from 26th, 27th, 28th, and 29th. If you want to identify the days of ovulation, the days you are most likely to get pregnant, you are supposed to count from the first day when you saw your periods, count 14 days. And on the 14th day, add 3 days in front and add 3 days backwards. We are saying that to calculate your ovulation days, you count the first day when you saw your periods and you count 14 days. On the 14th day, add 3 days, subtract 3 days, and specifically those are the days you are most likely to get pregnant. We shall go and do it practically. Assuming you saw your periods here, this is the first day you saw your periods, that is Monday 1st. So we are going to count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So according to this cycle, the 14th day is specifically here, and that is on Sunday. But according to our method, we said that when the egg has been released or when ovulation is taking place at this 14th day is the big period when you are most likely to get pregnant. We add 3 days in front. We say 1, 2, 3. Come back on the 14th day and we also add 3 days backwards and say 1, 2, 3. So the days you are most likely to get pregnant or the days of ovulation are from 11th, 12th, 13th, 14th, 15th, 16th, and 17th. Specifically 3 plus 3 you get 6, plus the 14th day which is 1 you get 7. So it's always that week. It's always 1 week. To get this, we shall go backwards. We shall repeat this again for our friends who have not picked it. We said that to understand the days you are most likely to get pregnant, we start from the first day when you saw your periods. Assuming you saw your periods around here, the first day of seeing your periods, count from the first day when you saw your periods, count 14 days and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And we've said that the 14th day is the day you are ovulating, but this process goes on for the next 3 days, and it also starts the first 3 days before you saw your 14th day. So you add 3 days in front, add 3 days backwards, and specifically from this period up to this period, those are your unsafe days or your days of ovulation. If you do not get pregnant in around here, then the egg goes into what we call a corpus. It becomes what we call a corpus luteum or a corpus luteal phase. The next 2 weeks are basically the egg which was supposed to become fertilized. The egg which was supposed to be fertilized, if it is not fertilized, the remaining follicle becomes what we call a corpus luteum. We shall talk about that in our next video, but in today's lecture, as I'm summarizing, we have been talking about how to calculate your ovulation cycle, how to calculate your ovulation days, how to track your safe days and your danger days using the calendar method. And we've said that simply to understand your menstrual cycle, you have to count from the first day when you saw your periods to the next day when you will see the next period. Thanks a lot for staying with me. Gerard Massa, the Health Educator, is the name of the channel. Have yourself a fantastic and healthy day. Remember to subscribe for new videos every day about women health. Bye-bye. Hello, welcome to our channel. I'm Gerard Massa, the Health Educator. On this channel, we talk about pregnancy-related questions. We answer all your on your uterine wall, on your uterine lining. We call this implantation, and then growth takes place, becoming a baby. So to answer the question, can you get pregnant on the first day of your period, we shall first of all take this as an example. If you see your periods on any particular date, for example, if you see your periods on 9 being your first day, we know that you have to count 14 days, and on the 14th day, that is when you are most likely to get pregnant. So to answer the question, can you get pregnant on the first day of your period? It's not really possible for you to get pregnant on the first day of your period. The main reason is that on the 14th day, that is when you are ovulating. That is when the chances of getting pregnant are very high. So on the first day, your periods are coming out, but it is really not possible to get pregnant on the first day, because the first week, the first day followed by the second day, the third day, and the fourth day, if you spend 4 days in your periods, normally there's shedding of blood, there's basically menstruation happening. So it's not possible for you to be pregnant, because that is not the period, that is not the time when you are ovulating. The only time you can get pregnant is when you are ovulating, and normally that is on the 14th day. And specifically, during the process of ovulation, there is a release of several hormones, but we shall talk about 2 main hormones here. The first hormone is what we call estrogen, and then the next hormone is progesterone. And also there's another hormone which is very important, and it is known as the luteinizing hormone. So the only way to confirm whether you are able to get pregnant is by using what we call the ovulation predictor kits. These can easily be got in any nearby pharmacy near you, and these can easily be used. They look like pregnancy test strips, but they can tell whether you are in your ovulation or whether you are about to get pregnant. So to maximize the chances of getting pregnant, if we take an example of 24th, if this is the date you are ovulating, we always advise that you be with your partner at least 1 day before your date of ovulation. The main reason is that the hormone known as the luteinizing hormone is actually very high when you are about to go into ovulation date. If you are about to enter your date of ovulation, then normally we advise that you be with your partner. So the only time you can get pregnant is during ovulation, 3 days before, 3 days after. That period you can easily get pregnant. If at all you are on your first day of your periods, it is not possible for you to get pregnant. And remember, this is Gerard. Can you have fertile cervical mucus but not ovulate? Can you have fertile cervical mucus but not ovulate? In this video today, we are going to answer the question, can you have fertile cervical mucus but at the same time not ovulate? Gerard Massa, the health educator, is the name of the channel. I'm really so happy to talk to you, my friend. Thank you for subscribing. You'll be able to get new videos I put out every day about women's health, about fertility, infertility, pregnancy related topics. On this channel, Gerard Massa will talk about women's health. So in today's lesson, can you have fertile cervical mucus but not ovulate? We are going to begin by defining what we mean by the term ovulation. Specifically, ovulation is the release of an egg which is mature, and this happens on the 14th day. If we take an example of this calendar, assuming we are using basically an example, if you saw your periods on day 3 and then on day 4 and then on day 5, what happens is that to calculate your ovulation date, the day you are ovulating, you specifically begin counting from day 3, and you begin counting, we take the first day you saw your periods to be our day 1, and then we shall say 1, 2, 3, and then we shall proceed and count up to 14. So this is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So if you saw your periods on day on 3rd, that being our day 1, your ovulation date is 16th. So ovulation means chances of getting pregnant are really increased. The chances of getting pregnant, or the day you are most likely to get pregnant, is what we call the ovulation day, and it's basically the 14th day from the first day you saw your period. We are using this as our background study to answer our question, can you have fertile cervical mucus but not ovulate? Having understood ovulation, that this is the release of an egg, which normally happens on the 14th day. An egg begins an egg is released when it actually is really small on the 14th day, and then it goes on. Actually, an egg begins growing during the follicular phase, and then it